All right, let's dive right into this explainer with a really high-stakes scenario so we can see exactly how traumatic brain injuries unfold in real time. We're going to look closely at the step-by-step nursing management and honestly the physiological chaos that happens when the human brain experiences severe trauma. It's a fascinating, highly structured, and incredibly fast-paced process where literally every single second counts. Picture this, we're stepping right into the emergency room with a patient we'll call Mr. X. He's a 30-year-old guy who has just survived a major road traffic accident, or RTA. And as our source material points out, RTAs are actually one of the leading causes of death and disability worldwide. Right now, Mr. X is lying in the trauma bay, and the medical team has to act immediately. But before they can even think about treating him, they have to decipher exactly what his body is trying to tell them. Now, you might look at his symptoms and think, okay, he's just really banged up. But these aren't just random symptoms, they are massive red flags, hinting at rising pressure inside his skull. Mr. X is coming in with a transient loss of consciousness, deep confusion, a severe headache, and projectile vomiting. And let me tell you, in a trauma context, projectile vomiting is a glaring alarm bell. It strongly suggests his brain is swelling, creating a super dangerous condition known as raised intracranial pressure. So before the team can fix him, they need to pinpoint the exact nature of the trauma. Basically, a head injury is broadly defined as any trauma to the scalp, skull, meninges, or the brain itself, caused by an external mechanical force. This physical force disrupts how the brain functions, whether that's just a temporary impairment like a mild concussion or a permanent, life-altering neurological dysfunction. Right off the bat, the team has to figure out which of the two main categories of trauma they're dealing with. On one hand, we have closed or blunt injuries. This is where the skull stays completely intact, but the brain inside gets bruised or violently shaken. Think concussions or diffuse axonal injuries. On the other hand, we've got open or penetrating injuries. This is where the skull is actually fractured or pierced by an object. This means the brain is totally exposed to the outside world, and suddenly the risk of a massive infection skyrockets. Now, if Mr. X is bleeding internally inside his intact skull, the nurses have to play detective to find out where that blood is coming from. It could be an epidural hematoma that usually comes from a fast-pumping arterial bleed between the skull and the dura. Patients with this often get knocked out briefly, wake up for what's